Welcome to the American College Health Association webinar for the Connected College Health Network program. I'm Sarah Van Orman from the University of Southern California, and I served as ACHA's president from 2016 to 2017. The American College Health Association is the leading voice for college health and well-being, representing almost half of the 20 million college students in our nation. As a leading advocate, we recognize that good physical and mental health are critical to student success. This has been highlighted by the growing mental health needs on our campuses. While institutions often invest heavily, we currently lack comprehensive information about the state of student health. This presents a significant public health challenge for both campuses and our nation as we strive to provide affordable, high-quality care, eliminate barriers to student access, and create environments that support health. Lack of reliable data can also be crippling during emergent public health situations, such as outbreaks of communicable diseases. We know that health-promoting policies, systems, and environments have a real impact on health, but aggregate data about these factors is not routinely collected on our campuses. The information which is available often exists in silos. For example, clinical health outcome data contained within electronic health records is not routinely linked at the population level to information about policies, services, and student academic outcomes. This can hold an institution back when it comes to developing health initiatives aimed at improving student success. It also prevents institutions from benchmarking and adopting best practices from across the field. Researchers and policymakers lack the tools to inform funding and policy actions which can promote student health. In response to these needs, ACHA created the Connected College Health Network, CCHN. CCHN is the first central data repository of de-identified student and campus-level health information. It brings together multiple data sources to develop a more complete picture of college health and well-being at campuses across our nation and internationally. Through integration of disparate data sources, CCHN can enable data-driven decision-making, which will inform college health at both the individual institutional level as well as at the local and national policy level. Improved decision-making can yield short and long-term benefits to both student health and academic success. A particular priority is identifying health disparities among college population and using this information to implement effective policies and services to close these gaps. CCHN includes data from various sources, structured in a way that is optimized for reporting and analytics. Data sources are linked by an IPEDS ID. IPEDS, the Integrated Post-Secondary Education Data System, is a system of interrelated surveys conducted annually to gather information from every college, university, technical, and vocational institution that receives federal funding. Through the IPEDS ID, CCHN can gather basic institutional data, such as the number and type of students enrolled, institutional characteristics, degrees earned, and other demographic data. Administrative data about the services and the campus health promoting environment is collected through the ACHA Institutional Profile Survey. The Institutional Profile Survey was launched in late 2018 to build a profile of the healthcare resources, services, and policies at each ACHA member school. The survey gathers information around the scope of medical, mental health, and wellness services, staffing and administrative support, and the presence of well-being programs and policies. Additional information focuses on factors such as student insurance, facility metrics, budget, service eligibility, and billing. Student health surveys provide population-level health and well-being information. The National College Health Assessment collects data about students' habits and behaviors. Launched in 2000, NCHA is the largest known comprehensive data set focusing on the health of college students. Comprised of 8 sections, it covers topics such as sense of community, personal safety and interpersonal violence, alcohol, tobacco, and other drug use, sexual behavior and contraception, weight, nutrition, and exercise, mental health, well-being, and help-seeking behaviors, acute and chronic illnesses, sleep patterns, impediments to academic performance, and the demographic characteristics and basic needs of respondents. The Healthy Mind Study is a mental health-focused survey of college and university populations. It includes questions about depression and anxiety assessed using well-established screening instruments, information about other mental health symptoms, health behaviors and substance use, help seeking, stigma, and perceived discrimination on campus. The survey also captures demographic information such as race and ethnicity, gender, citizenship, degree level, field of study, and year in school. Clinical data is available from the College Health Surveillance Network. The College Health Surveillance Network is the first national database of student health clinical data. It houses de-identified diagnosis and visit data obtained from over 30 student health centers. The College Health Surveillance Network has gathered more than 1 million enrolled students' records to date. Data collection includes ICD diagnosis and CPT procedure codes, key demographics, and geographical variables. The data from the College Health Surveillance Network provides the ability to study health outcomes and conduct surveillance longitudinally. During later phases of the CCHN program, ACHA will build linkages to electronic health record systems, expanding the clinical data collected through the College Health Surveillance Network. Future options for data include the addition of insurance claim information and academic indicators. CCHN can be leveraged for a variety of purposes. Surveillance is a foundation of public health practice. Data from CCHN can be extracted to help monitor health trends, both infectious and in non-infectious health conditions, behavioral risk factors, and exposures. Such surveillance can serve as an early warning system for impending public health threats and emergencies, document the impact of interventions, and track progress toward specified health goals. It can help monitor the epidemiology of health problems in the college population. Insights gained can inform policy, guide new program interventions, and improve public health communications. Like surveillance, benchmarking requires continuous and collaborative data from multiple sources. Robust benchmarking tools are particularly important because ACHA recognizes that services for students are organized differently at various institutions. CCHN allows users the opportunity to examine a particular set of measures at a campus with an organizational structure similar to their own. With the CCHN Business Intelligence Platform, they can directly compare their institution against institutions with similar demographics to be assured that they are providing robust services and aligning with best practices in the field. Reports can be customized to their needs. CCHN also allows institutions to understand the bigger scope of care delivery, campus environment, and student health outcomes to improve the quality of their campus health program. The creation of CCHN began with asking, why do college health professionals need data? What data do they need? Through member feedback, a list of analytics was created based on a prioritized list of outcomes. Key indicators are organized around 4 dimensions: reducing the per capita cost of healthcare, improving the health of the student population, improving the patient experience of care, and improving student academic outcomes. Indicators can be reported for both individual institutions as well as for the entire group of participating schools. A data visualization tool sits on top of the CCHN data warehouse and makes it possible for users to query the data to create reports, charts, dashboards, and other data tools. Once securely logged into CCHN, users can explore, share, and create reports. Their dashboard will be brought to life visually by selecting the data source of information they would like to see. For example, reports used for disease surveillance can be created using multiple data variables from the College Health Surveillance Network data source. These use aggregated, de-identified patient data to summarize the top diagnoses, laboratory tests, radiology orders, and immunizations at participating health centers. Rates of various items can be calculated using the institution enrollment size as a denominator. Each dashboard contains customized views of data, all of which can be filtered by clicking on the data field. This allows exploration of health conditions for various student populations and can be the foundation of health equity work. Within CCHN, a number of predefined, ready-to-run reports are provided. Additional reports are available for each of the data sources, providing a summary of key findings and survey responses. For users with advanced analytics access, CCHN offers users more control over the data they have access to, enabling them to generate and customize reports with any combination of institutional characteristics, student demographics, and using data from multiple sources. For example, data from the Institutional Profile Survey or National College Health Assessment Survey can be joined with IPEDS data to create a richly detailed data set for further analysis and research. Users can take any slice of data and export or share it by clicking on the appropriate feature. They can also embed an interactive slice of data on their school web page by simply clicking the appropriate feature. Users can explore different types of charts by selecting a chart of preference and running the query. This allows the data to be visualized, analyzed, and shared in ways that fits their needs. Once edits are made, the information can be saved to create a custom dashboard. Advanced users can also create new views of data by connecting various fields in Advanced SQL Lab. This allows users to create powerful custom reports that can be saved and shared as preset canned reports and dashboards. Participant data is contributed without any personally identifiable information, and student data in CCHN is shared only in de-identified aggregate form. Identification of individuals is never possible. Institutions will be identifiable to other users for select institutional profile data elements marked open. These fields ask for information that is not considered sensitive or protected and which is generally publicly available. For example, the presence of a tobacco-free policy on campus. A field mark open means that other CCHN participant institutions can see answers to these questions, and the results are identifiable by school. It is intended that access to this information will provide an important benefit by allowing members to consult and network with one another based on their responses. No other data will be identifiable at the institutional level. Items not marked as open are used only as part of aggregated, de-identified pools of information in queries and reports. Access to data is permissions-based. CCHN is operated in a virtual private cloud within Amazon Web Services. Security groups are set up in CCHN to manage traffic and act as a firewall. CCHN takes full advantage of identity and access management services, where each user is provided with specific credentials appropriate to their role. CCHN assures security, protects privacy, and has integrity while efficiently and effectively serving the needs of its users. CCHN is more than just a data warehouse. It's analytical tools, accessible to users to build their own custom reports. It's a data silo buster, crossing public and private organizations. It's actionable, enabling data-driven decision-making. Bringing the world of college health information together, CCHN enables users to improve the effectiveness of their college health programs. We invite you to be part of the future of college health. To learn more, visit the ACHA Connected College Health Network program page. Thank you.